comparative chart of all 4 Haemoprotozoan disease. These are babesiosis, theileriosis, anaplasmosis, and trypanosomiasis. The organism name in case of babesiosis is Babesia ovis or Babesia motasi. But in case of theileriosis, there is Theileria hipki and Theileria ovis. In case of anaplasmosis, the organism name is Anaplasma ovis. But in case of trypanosomiasis, the causative organism is Trypanosoma evansi. The disease is transmitted through tick in case of Babesia, that is Rhipicephalus and Haemophysalis species. In case of Theileria, Hyloma and Rhipicephalus species transmit the disease. In case of anaplasmosis, Hyloma and Buphyllus species transmit the disease. In case of trypanosomiasis, CC fly, blood-sucking flies, example Tabanus and Stomoxys, these are transmitting the disease. In rest all three, there is a tick transmit the disease, but in case of trypanosomiasis, there is flies like Tabanus and Stomoxys, which are spreading the disease. Route of infection in all three are tick infestation, but in case of trypanosomiasis, there is biting fly, which spread the disease. And the age-wise susceptibility in babesiosis, adult animal, but in case of theileriosis, there is young animal. In case of anaplasmosis, there is animal involved that is 6 months to 2 years of age. But in case of trypanosomiasis, there is young animal which are susceptible to the disease. In case of babesiosis, there is a inverse age resistance. In that case, adult animals are more susceptible for the disease as compared to young ones. Now coming to the symptoms, in case of babesiosis, there is fever, anorexia, fast and audible heartbeat, pale mucous membrane, stress, there will be hemoglobinuria, abortion and emaciation. But in case of theileriosis, there will be lymphadenopathy and there will be respiratory sign can be seen, anemia, fever, diarrhea and anorexia can also be seen. But in case of anaplasmosis, there will be the failure of the mucous membrane, anemia, jaundice, respiratory distress, ruminal stasis, abortion, and edema of submandibular region can also be seen. But in case of trypanosomiasis, there will be diarrhea, intermittent fever, enlarged lymph node, rapid pulse, lacrimation, and progressive emaciation can be seen. Important for the babesiosis, hemoglobinuria, and for the theileriosis is inflammation of the lymph node and lymphadenopathy. In case of anaplasmosis, there will be edema of the submandibular region. In the trips, there is intermittent fever along with enlarged lymph nodes. For lesions, now coming to the liver, in case of babesiosis, there is necrosis. But in case of trypanosomiasis, there is congestion and hepatomegaly. But in case of theileriosis, there will be enlarged liver and pseudo-infarction in liver can be seen. In case of anaplasmosis, there is yellowish color liver. In case of spleen, there will be splenomegaly, but there will be soft and splenic pulp. Soft and splenic pulp can be seen. In trypanosomiasis, there will be enlarged dark red splenomegaly. And in case of theileriosis, there is small and large hemorrhages. Small and large hemorrhages can be seen along with splenomegaly. And in the case of anaplasmosis, there is splenomegaly. Splenomegaly is the common, but in case of babesiosis, there is soft splenic pulp. But in case of trypanosomiasis, there is enlarged dark red color of spleen. But in case of theileriosis, there is the pinpoint large and small hemorrhages. Now coming to the heart, in case of babesiosis, there will be congestion of the blood. But in case of trypanosomiasis, there will be hydropericardium and gelatinous fatty degeneration can be seen in case of heart. But in theileriosis, there will be congestion in the heart. But in case of anaplasmosis, there will be no lesion. In case of kidney, in case of babesiosis, there will be enlarged and congestion. But in case of trypanosomiasis, there will be gelatinous fatty degeneration. In case of theileriosis, there will be congestion and petechial hemorrhages in the kidney. There will be congestion and petechial hemorrhages. But in case of anaplasmosis, there will be nephrosis. Coming to the lungs, in case of babesiosis, there will be congestion. In case of trypanosomiasis, there will be hydrothorax. But in case of theileriosis, there is pulmonary edema and hyperemic lung. In case of anaplasmosis, there will be pale and edematous soot. In case of urinary bladder, in babesiosis, urinary bladder will contain dark color urine. But in case of atrips, theileriosis, and anaplasmosis, there will be no lesion in the urinary bladder. In case of gallbladder, in case of babesiosis, gallbladder is distended with the thick and dark bile. But in case of trypanosomiasis, we will not find any lesion in the gallbladder. In case of theileriosis, there will be distended with thick bile. But in case of anaplasmosis, there will be yellowish green bile present in the gallbladder. But in case of trypanosomiasis, there will be no lesion in the gallbladder. In case of body cavity, we will not see any changes in the babesiosis, but in case of trypanosomiasis, there will be ascites, petechial and ecchymotic hemorrhages on the serous surface of the body cavity. And same in the theileriosis, we will not find any lesion in the body cavity, but in case of anaplasmosis, there will be anasarca and presence of straw-colored fluid in body cavity. There will be anasarca and the presence of straw-colored fluid in body cavity. But in case of babesiosis and theileriosis, we will not find any lesion in the body cavity. Carcass appearance. In case of babesiosis, there will be ectric and emaciated carcass. There will be ectric and emaciated carcass. But in case of trypanosomiasis, there is pale muscular atrophy and dehydrated carcass. There will be dehydrated carcass. In case of theileriosis, there will be ectric carcass with accumulation of the serous fluid. And in anaplasmosis, there is emaciated, pale, and ectric carcass. Coming to the blood, in case of babesiosis, there is a thin and watery blood. In case of blood, there will be thin and watery blood, but in other cases, in trypanosomiasis or theileriosis or anaplasmosis, we will not find any lesion or any changes in the blood.